We're just going to go over a couple of standards, primarily one, which is positioning for pulse diagnosis in Dr. Jimmy Chang's style. And we'll go over that in a second. And also this manual Pulse Synergy, which is his book, is, if you're interested in learning the style, is paramount, along with, of course, following the programs that are prescribed that Evergreen provides many in the year. Goes through the whole process of Pulse 1, 2, 3, I think there's a 4, as well as doing the herbal medicine classes and doing Fang Jia Fang. So understanding them together, it's a system that primarily goes together for diagnosis and treatment. So the differences are really small, but imperative to know in terms of location. So first of all, I also have a recording chart here to draw the pulse. So certainly from what we've already gone over in the class, we've had some further understandings about the different positions and what they mean. But again, we're working on the radial pulse, so hopefully you have a situation where you have a desk and a place for the patient to be comfortable. And on the left arm, we're looking first of all for the first position to be on lung 9, Tai Yuan. So lung 9 is the first position. Styloid position, styloid is in between the first and the second. And then, of course, the third position. Now, always we want to be touching the radial pulse. So we don't want to be missing it. Of course, here, as we move more up to the further point, most proximal to the patient, which is the chur position, we're going to see that kind of slide a little bit more medial into the arm. So by no means do you want to miss that. Also, another common mistake that people make is they hold their hand on all at once, press all of them down, and when you do that, the radial artery is being blocked, so you certainly can't get a good feel for what's going on. Now, you can come in and check overall what's happening, but you want to do each one individually. You want to hold on the back. You don't want to use the tip of your finger. You want to use the pad of your finger. When you're holding it, you want to be supported in the back, pad touching the point, and also you want to have some flexibility so that you can move even within that area to see if you're noticing the pulse go in any direction. Certainly can go more distal towards the thumb. There's 3 other pulses up there which we're not going to review now, but if you endeavor this particular style more, you will certainly learn about that, going into different aspects of the body, primarily going up into the head. From this is of course the chest, so we're considering this lung 9 point, Tai Yuan, the Sun position, to be on this particular side, heart, small intestine, primarily heart. So we're looking for many of the different qualities that we've already discussed, and we want to skip the styloid process. The next point is the guan, this is the liver, and then the third position, of course, which often we can find with 2 fingers. So first we find the first position, then we go to the second position, and to the third using the same 2 fingers. Much more dexterity with these first 2 fingers. We use these all the time for many tasks in life, so by no means do we want to forfeit them now at this particular time when something is so nuanced and potentially so subjective. We want to leave as much subjectivity out, but of course some of it is entirely necessary. So in feeling the pulse, one at a time, relieve the other one, onto the chur. Also we want to potentially notice if there's any nuance in between Sun Guan chur. So oftentimes we'll see in between the pulse if there's something going on that needs to be noted that oftentimes could speak volumes to the condition of the patient, whether it's history or something currently happening. When we move to the chur, also we want to follow up and see if it's going further up the arm, being more pathological. And of course, if we find that there's either the pulses are extremely mild and low, we may want to go up and check the brachial pulse. So if these are nice and even and really slow and this is strong, by all means you'll hopefully study the pathology of that. And also if they're bounding, we want to go check the brachial pulse as well. Now, oftentimes you're going to find the brachial pulse being strong, potentially without reason. I always ask people if they're taking NSAIDs or if they are taking some type of pain medication, because that is going to change the blood flow in and out of the kidney, and therefore going to change and increase the palpable detection of the brachial pulse here. So by all means you want to take note of that, because issue could potentially be an issue with the kidney. If someone's taking something, some type of pain medicine, especially NSAIDs, we're going to notice that be more increased, and that would certainly be a good thing at that time if that was increased and there was no other pathology. So just to review, Taiyuan, lung 9, this is Sun, Guan, it's on the other side, the proximal side to the patient, for the Guan liver pulse. And then and also noticing in between. And then moving on to the chur, use those same 2 fingers and take it out to the end. See where that pulse goes to, if it continues or not. Actually, it's more pathology when it continues on up to pulse or a bigger pulse. So once again, I think that clarifies the positioning and the difference. So essentially we're looking at heart, liver, and in this, on the left side, we're considering the reproductive area, but also the lower body. So there's a whole scale of tales to be told and how to understand the pulse in those different positions. And I encourage people strongly to follow up on those classes, and if that really seems to speak to you, then by all means, once you get your chops together, go spend some time and do some interning with Dr. Chang. I think it has been invaluable in my understanding of pulse and further diagnostics. Not to mention, when we start out in this way, initially I'll have the patient sit down, and I'll start obviously with the right side and do some particular diagnostics from the forearm, which I'm not going to review now. But in doing that, I just tell them initially, first thing I'd like to do is check out your body from a Chinese medicine standpoint, and then once we finish with that, we will discuss the reasons why you're here. So I also may suggest, I may mention all kinds of things that are related or unrelated to your condition, but again, it's how we have to work in and around the condition that is your chief complaint. So again, this is another method like auricular medicine, in that we can detect the problem without necessarily asking first. So using subjective and objective findings, and obviously the more you do this, the subjective becomes objective in order to determine what's happening there. So again, understanding the process, and then of course familiarity with it, practice certainly helps scale that up to a more objective viewpoint. That's it.